Today, we're diving into what's behind the global decline in birth rates, why it matters, and how it's shaping the future of family creation. Whether you're on your own fertility journey, supporting someone else, or just curious about this growing issue, this episode is for you. Welcome to the Fertility Cafe, where we explore the beautiful complexity of modern family building. I'm your host, Eloise Drain, and this is a space for honest conversations about surrogacy, egg donation, and the journey to parenthood. With expert insights and real stories, we're here to guide you through the medical, legal, and emotional aspects of third-party family building. We believe that love has no limits, and neither should parenthood. I'm your host, Eloise Drain. Today's topic is one I've spoken about several times on this podcast. It's an issue that continues to grow and make headlines. Birth rates are declining around the world. This isn't just another statistic, it's a wake-up call. Birth rates have hit historic lows in the US and many other countries, and the ripple effects impact everything from economics to social structures, the environment, and even our day-to-day lives. Over the years, I've seen more and more people struggling with infertility, not just later in life, but at younger ages as well. While greater awareness and access to reproductive technology explain part of the trend, they don't tell the whole story. So, why is this happening? And what does it mean for all of us? The reasons behind these crises are complex, but they all tie into a broader conversation about modern life, our health, our lifestyle choices, and the world we live in. Let's start with the basics, the numbers. The numbers tell a story. Here in the US, we're seeing the record lows in birth rates. In 2023, the CDC reported only 3.5 million births, translating to about 55 births per 1,000 women of childbearing age. Globally, the picture is similar. Countries like South Korea and Japan have birth rates far below the replacement level of 2.1 children per woman. Meanwhile, India, traditionally a high birth rate nation, is also seeing significant declines. What's especially interesting is how rapidly these changes are happening. Just a few decades ago, many of these countries were experiencing population booms. Now the conversation has flipped entirely, with the nation struggling to maintain population growth. This isn't just a short-term trend. It's a long-term shift with global implications. Experts predict that by 2100, the world's population will peak and then start declining. At first glance, that might sound like it eases some pressures like overpopulation or resource scarcity. But the ripple effects are far more complicated and not always positive. The generational shift. Let me share a personal observation that really brings this home. In just 3 generations, we've seen dramatic changes in family size. Think about it. Many of our grandparents had large families. 12 or 13 children wasn't uncommon. Their children, our parents' generation, might have had 5 or 6 kids. And now, most families stop at 2 children, if they have any at all. Why are birth rates falling? Honestly, there's no single reason. Instead, it's a complex web of factors working together. Economic pressures. Let's start with the money issue because, let's be honest, raising kids isn't cheap. Housing, healthcare, education, and childcare costs just keep going up, while wages seem to be stuck in neutral. For many families, the math doesn't add up. That's why so many are either delaying having kids or deciding it's just not in the cards. Here's an added layer: student debt. According to the Federal Reserve, Americans owe over 1.7 trillion in student loans, and this burden disproportionately affects younger generations. The impact? Millennials and Gen Zers are often delaying major life milestones, like starting a family because financial stability feels out of reach. And it doesn't stop there. The housing market is another major obstacle. In many cities, rising home prices and rental costs make it difficult to afford a space large enough for children. A 2023 study showed that nearly 30% of prospective parents cited housing costs as a key reason they were postponing having kids. If you're someone who needs fertility treatments to build your family, the costs get even steeper. On top of IVF itself, you've got medications, genetic testing, travel expenses, and even lost wages to consider. And don't get me started on insurance. It's often limited, and employer benefits rarely cover the full picture. Let's not forget that success with IVF often takes more than one try, which adds to the financial strain. For many, these costs turn dreams of parenthood into something that feels out of reach. Medical factors. Medical challenges also play a major role. Rates of conditions like PCOS, endometriosis, and uterine fibroids are on the rise, making conception more difficult for many women. Meanwhile, men are seeing declining sperm counts and motility, issues tied to everything from environmental toxins to poor diets. And it's one thing to note, infertility isn't just a me problem anymore. It's becoming a societal challenge. According to the World Health Organization, 1 in 6 people will experience infertility at some point in their lives. That's huge. The role of birth control. Now, let's tackle an interesting question. Could birth control be a part of this? Hormonal birth control has been life changing for so many people, giving them control over when and if they want to have children. But, and it is a big but, there's anecdotal evidence that some women struggle to conceive after long term use. While studies say there's no lasting impact, it's clear we need more research on how hormonal contraceptives could be influencing fertility over time. Environmental factors. Endocrine disrupting chemicals, EDCs, in our everyday products are having a significant impact on reproductive health. These chemicals found in plastics, personal care items, and food packaging are disrupting our hormones in concerning ways. The evidence is striking. Sperm counts have dropped by over 50% in the past 5 decades, while cases of diminished ovarian reserve and miscarriages continue to rise. These common chemicals, including phthalates, BPA, and PFAS, are playing a troubling role in fertility challenges. If you'd like to understand more about this important issue, we explore the science behind these effects in depth during episode 35. The LGBTQ plus perspective. With around 3 million LGBTQ plus individuals in the US actively pursuing options like adoption, surrogacy, and IVF, many still face significant barriers to fertility care. Gaps in healthcare training leave providers unprepared to meet LGBTQ plus family building needs, leading to inadequate care and discrimination that often makes same sex couples, transgender individuals, and single parents feel marginalized. Legal definitions of infertility in some states further exclude LGBTQ plus individuals from insurance coverage, as they do not meet the traditional criteria of unprotected heterosexual intercourse for 12 months. As a result, many are forced to pay out of pocket for costly fertility treatments, making the path to parenthood even more challenging and financially burdensome. Shifting priorities. More people are choosing to focus on their education and careers before starting a family, which is fantastic. But it also means the timeline for having kids is getting pushed later and later, often into the 30s or 40s. But here's the catch. Age is a huge factor when it comes to fertility. Waiting longer can make it harder to conceive naturally, and it often leads to needing help from assisted reproduction. It's a tough balancing act between building your life and building your family. The biological clock, not just for women, but for men as well. While we often focus on how a woman's fertility declines with age, research now shows that older parental age is also linked to increased risks of miscarriage, genetic disorders, and lower fertility rates. This is an important consideration as more couples delay parenthood. Changes in marriage and family life. The landscape of marriage and family formation has undergone significant transformation in recent decades, marked by two notable trends: First, there's been a substantial delay in marriage and parenthood, with the average age of the first marriage in the US rising to 30 for men and 28 for women, compared to the early 20s in previous generations. A shift that often aligns with prioritizing higher education and career advancement, but can present fertility challenges. Evolving gender norms are reshaping family dynamics, as the traditional model of women as primary caregivers and men as breadwinners gives way to more flexible arrangements. Though this shift, while promoting gender equity, has introduced new complexities in how people approach parenting decisions, including financial considerations in dual income households, the choice to delay or forego children, and the desire for more equitable partnerships. Cultural shifts. Cultural factors are playing a significant role in shaping decisions about family building today. Conversations about overpopulation, climate change, and resource scarcity are leading many to choose smaller families or no children at all. Societal norms and pressures have also shifted, with the expectation to have children easing in many places. However, this shift comes with layers of complexity, geographic and access barriers. Where you live matters. Fertility clinics are mostly concentrated in urban areas, creating fertility deserts in rural regions. People in these areas face long travel times, higher costs, and limited options for treatment. For some, even relocating or switching jobs become necessary just to access adequate fertility benefits. Technology and innovation impacts. Advances in technology and medicine have made parenthood more accessible in some ways. Fertility preservation options like egg freezing and genetic screening are empowering people to plan their families on their own timelines. However, these technologies come at a high cost, often limiting access to those with significant financial resources. Meanwhile, developments in telehealth are helping reduce geographic barriers, making initial consultations and follow ups easier. But the reality is that most fertility treatments still require in person visits, which means technology alone can't bridge the gap for those in rural areas. Lifestyle factors. Modern lifestyle factors are creating additional challenges for fertility health. Chronic stress has been shown to affect menstrual cycles, sperm quality, and even the success rates of fertility treatments. The impact of obesity is equally significant, with nearly 40% of U.S. adults affected. The resulting hormone imbalances can lead to fertility challenges, including PCOS in women and reduced testosterone levels in men. Alcohol consumption also plays a role, as even moderate drinking can disrupt hormone levels, impact reproductive function, and significantly increase conception times for couples trying to conceive. Marijuana use presents its own set of fertility challenges. In men, it can reduce sperm count and motility by up to 28%, while in women, it can disrupt the menstrual cycle and delay ovulation. Regular cannabis use has also been linked to changes in reproductive hormones in both men and women, potentially making it more difficult to conceive. The global perspective. In some regions, cultural taboos around reproductive health persist, leaving people misinformed or feeling isolated. These taboos can delay care and make the journey toward parenthood even more challenging. By contrast, in more progressive societies, open conversations about family building have helped normalize diverse parenting paths from adoption to surrogacy. Emotional and psychological toll. Let's not forget the emotional toll. Infertility is deeply personal, yet it's also becoming a widespread societal challenge. Imagine trying to navigate a complex healthcare system while dealing with grief, shame, or relationship struggles. Add the financial strain and societal pressures, and it's no wonder so many people feel overwhelmed. When you add up all the pieces, the money, the timing, the environment, the stigma, it's clear why birth rates are falling. And honestly, unless something changes, this trend isn't going anywhere. Healthcare access. Access to healthcare plays a critical role in fertility and family building journeys, yet it's riddled with disparities and challenges. Racial disparities. Racial inequities in healthcare have profound impact on fertility outcomes. Studies show that Black women are twice as likely to experience infertility compared to white women, but are far less likely to receive treatment. Factors like implicit bias in medical settings, limited access to high quality care, and financial barriers disproportionately affect communities of color. For example, Black women are more likely to have conditions like uterine fibroids that can impair fertility, yet they often receive delayed diagnoses or substandard treatment. Insurance coverage issues. Insurance is a key barrier for many seeking fertility care in the U.S. While some states mandate coverage for infertility treatments, these laws often have loopholes. For instance, coverage limits. Many plans only cover a portion of fertility treatments or cap the number of cycles covered. Exclusions for advanced care. Treatments like egg freezing, surrogacy, and genetic testing are rarely covered. Employer variability. Coverage is highly dependent on the employer, leaving millions without access. Additionally, out of pocket costs can be staggering. Even when insurance provides partial coverage, expenses like medications, genetic testing, and donor sperm or eggs can push the total costs into the tens of thousands of dollars. Moving toward equity. Addressing healthcare access disparities requires systemic change. Expand insurance coverage to include comprehensive fertility treatments and eliminate exclusions for LGBTQ individuals. Train providers to address implicit bias and improve cultural competency, particularly for racial and LGBTQ disparities. Advocate for federal policies that align with international models, ensuring fertility care is recognized as essential health care. Fertility care shouldn't be a luxury. Bridging these gaps can make the dream of parenthood more accessible for all. International healthcare comparisons. Globally, fertility care access varies dramatically. In countries like Denmark and Israel, fertility treatments such as IVF are often fully covered by national healthcare systems, making them widely accessible. By contrast, in the US, fertility care is often prohibitively expensive, with IVF costs averaging 12 to 15,000 per cycle, not including medications or any other additional testing needed. These differences highlight the significant barriers Americans face compared to their counterparts in countries with more comprehensive healthcare policies. Why it all matters to all of us. So, why should we care? If fewer people are having kids, isn't that a personal choice? Well, it's bigger than that. This shift impacts all of us, whether we realize it or not. This isn't just about personal family planning. It's about the future of our societies. Government leaders worldwide are viewing this as a matter of national urgency. They're worried about aging populations. As birth rates fall, older generations make up a large share of the population. This creates challenges for healthcare systems, pensions, and social programs, which rely on a steady flow of younger workers. By 2050, 1 in 6 people worldwide will be over the age of 65. With fewer young people entering the workforce and more older adults needing care, it feels like we're tipping the scales in the wrong direction. Who will care for the elderly? Who will keep the economy moving? These aren't just the theoretical questions, they're realities many countries are grappling with right now. Economic impacts. Here's the deal. When birth rates fall, the economy takes a hit. Imagine fewer workers, less innovation, and dwindling consumer spending. It's like trying to drive a car without enough gas in the tank. Industries like tech, healthcare, and education struggle to fill jobs. Social security systems start to feel the squeeze with fewer people contributing to taxes. And let's not even get started on housing markets or retirement funds. They're already feeling the strain. We've seen countries like Japan and South Korea offer child subsidies and tax breaks to boost their birth rates, but it's an uphill battle. A shrinking population creates ripples that affect everyone, whether or not you have kids yourself. Environmental implications. On the flip side, fewer people might sound like a win for the planet, less resource consumption, right? But here's the catch. A smaller population also means fewer minds working on big challenges like clean energy, conservation, and sustainable farming. Progress doesn't just happen on its own. It takes people to make it happen. So while there's an environmental upside, it's far from the whole story. Societal impact. Now let's dig into how this really affects our day to day lives. Healthcare system strain. Think about this. As more people age, the healthcare system has to pick up the slack. More chronic illnesses, more long term care. Who's going to handle it all? Demand for elderly care. We're already seeing the strain with resources being redirected to manage age related conditions like Alzheimer's and heart disease. Shrinking workforce. Add to that a dwindling supply of young healthcare workers, and you've got a recipe for overwhelmed hospitals and overworked caregivers. It's not just a crisis for the elderly, it impacts everyone. If resources are tied up, younger generations might struggle to get the care they need, whether it's fertility treatments or routine checkups. Generational effects. Here's a scenario to consider. Imagine being one of just two siblings responsible for your aging parents without a network of extended family to help out. Sounds stressful? That's the reality for a growing number of people. Caregiving pressure. Smaller families mean fewer hands to share the load, putting emotional and financial strain on those left to care for aging relatives. Shrinking family networks. Gone are the days of big family reunions with dozens of cousins and uncles. As family sizes shrink, so do the support systems we've traditionally relied on. Legacy challenges. Fewer people to pass down stories, traditions, and cultural identities mean we risk losing those vital connections over time. These aren't just personal challenges. They reshape how we think about family, community, and even identity. What this means for family building. If you're here, chances are you're already connected to the world of family building. So, how does this global trend affect you? Growing awareness of fertility challenges. The conversation around infertility is becoming more open, which is a positive step forward. More people are sharing their stories, breaking down stigma, and seeking help when they need it. The vital role of surrogates and donors. For surrogates and egg donors, your role is more critical than ever. You're helping families grow in a world where fertility challenges are becoming increasingly common. Advocacy for accessible treatments. For intended parents, this trend underscores the importance of pushing for better access to fertility treatments. Whether it's advocating for insurance coverage or supporting policies that make family building more affordable, there's more work to be done. So, what can we do about it? Where do we go from here? While we can't reverse these trends overnight, there are actionable steps we can take to address the factors behind declining birth rates and rising infertility. Policy solutions. Policymakers have a vital role to play in creating a supportive environment for family building. Paid family leave. Expand access to paid paternal leave to alleviate the financial and logistical burdens of raising children. Childcare subsidies. Provide affordable, high quality childcare options to help working families balance careers and parenthood. Fertility coverage mandates. Enforce state and federal policies requiring insurance to cover infertility treatments, including IVF, egg freezing, and surrogacy, without discriminatory definitions of infertility. Chemical regulation. Strengthen regulations on endocrine disrupting chemicals like BPA and PFAS to protect reproductive health. Workplace recommendations. Workplaces can foster family friendly environments by adopting policies that support both current and prospective parents. Flexible work schedules. Offer options like remote work, compressed work weeks, and flexible hours to accommodate family needs. Fertility benefits. Partner with insurance providers to include fertility treatments, egg freezing, and adoption assistance in employee healthcare plans. Parental support programs. Provide on-site childcare, lactation rooms, and mental health resources tailored to parents and those undergoing fertility treatments. Healthcare improvements. Healthcare systems must address access to disparities and improve services to support family building. Expand access. Ensure fertility clinics and specialists are available in rural and underserved areas to eliminate fertility deserts. Address disparities. Reduce racial inequities in fertility care by training providers to recognize and address implicit biases. Improve LGBTQ plus inclusion. Develop guidelines and train providers on inclusive care practices for LGBTQ plus individuals, ensuring equitable access to fertility treatments and family building resources. LGBTQ plus advocacy points. Advocacy is crucial to address the unique challenges faced by LGBTQ plus individuals and couples. Legal protections. Advocate for laws that recognize LGBTQ plus family structures and protect their access to adoption, surrogacy, and fertility care. Public awareness. Launch campaigns to normalize LGBTQ plus family building and combat stigma. Insurance equity. Push for healthcare policies that remove discriminatory definitions of infertility, allowing LGBTQ plus individuals to access benefits without unnecessary legal or medical hurdles. Community action. Building connections and fostering community can make a huge difference. Support networks. Create and join groups for intended parents, surrogates, and donors to share resources, experiences, and encouragement. Volunteer and advocate. Work with organizations that promote fertility awareness, environmental protections, and family building inclusivity. Educate and empower. Host workshops and share information about reducing risks, navigating healthcare, and accessing support for diverse family building options. Reduce environmental risks. Small daily changes can also contribute to the bigger picture. Limit exposure. Choose BPA-free products. Avoid plastics when possible. And filter drinking water to reduce contact with harmful chemicals. Adopt a healthier lifestyle. Prioritize nutrient-rich diets, regular exercise, and sufficient sleep to improve overall reproductive health. Closing segment. The global decline in birth rates is a wake-up call. It's not just a statistic. It's a challenge that touches all of us, whether we're building families, supporting someone who is, or simply navigating a changing world. But here's the good news. We can adapt. By staying informed, advocating for change, and supporting each other, we face this challenge head on. Thank you for joining us at the Fertility Cafe. If you found value in today's episode, please subscribe, leave a review, and share with someone who might benefit from this information. You can find show notes and resources from this episode in the description or visit thefertilitycafe.com for more information.